हुसैन कोलाची यूट्यूब चैनल से और हमारे MCPS लेक्चर क्लास से हम आपको वेलकम करते हैं। और आज हम 20 फरवरी 2024 को आपसे मुखातिब हैं। आप देखेंगे कि आज मौसम और हैदराबाद की जो हवा है वो भी नॉर्मल है। तो जो टॉपिक है वो कम्युनिटी मेडिसिन के लेक्चर से है और पर्टिकुलरली वी आर फोकसिंग फॉर द MCPS, FCPS, MBBs as well as the community medicine of M.Phil, MPH, MSPH and even the nursing. The main topic is uses of epidemiology. Next. Yes, so epidemiology is already defined, but the learning objectives are particularly uses of epidemiology and difference between clinical medicine and epidemiology, and how we can apply the epidemiology in a daily life. Particularly, its uses are ingrained in this. Next, please. Yes, so the epidemiology is from the Greek term epi means upon, demos means population, and logos means scientific study. So it is basically a disease which is in population, and this subject studies, and we call it in simple terms 3Ds. That is this dynamics, distribution and determinants of the diseases. And dynamics here means how to control when you understand the risk factors. Yes, next. This is a study definition of epidemiology, study of frequency, distribution and determinants, and I have already mentioned that these are the 3Ds. Health related states and events, not only the diseases but health related states and events, and application of knowledge in prevention, control and mitigation of these problems, whether they are health states or they are events or they are diseases or any other problem which affects the health of the population. Yes. So you can see that the epidemiology was born before clinical medicine. This is the history 400 BC, the human disease to the environment, occurrence of human disease to the environment by the Greek philosopher. And even in Indus Valley, if you see the Vedic scripts and other things, the health is, and the Ayurvedic was the system of the healthcare in Indus Valley, which means that the science of life, it encompasses all the three factors, and we will discuss what was the Pitta, Kapha and other things also. And you can see that from 400 BC, the epidemiology has developed into a full science. Next, please. Yes, major breakthrough of epidemiology came from the HIV/AIDS, and preventive recommendation ultimately identified the needle sharing and promiscuity. Next. Uses of epidemiology, that is our main topic. There are four important uses. One is in healthcare management, means how you will plan it, how you will provide the services. Suppose EPI services, then what is the population, what are the infrastructure, and how in different seasons, just as polio campaign is going on in Pakistan, but still we have not eradicated the polio. So that is basically a management failure. Understanding the disease and its process means natural history of the disease, which encompasses the agent, host and environment. And third is in public health practice, epidemiology is used for cause, effect as well as the risk factor identification, so that you can launch the prevention. as well as you can compare over the time whether the incidence has reduced, new disease has emerged, or incidence has. So rise and fall of the disease is one of the application in the public health. Then in clinical and preventive medicine, therapeutic trials, clinical trials, as well as various comparative studies between two procedures. In that study, one is example of the sanitation, or it was a TB sanatorium in the past 50 years ago, but ultimately it was converted into DARS, which is directly observed treatment short courses, and now all the sanatoria are the places where people were just given a fresh air, good nutrition, and some kind of the treatment. Ultimately, the home treatment and sanitary treatment were at the same level. So ultimately, that shift has occurred, and same is true for the LHW programs, where doctors are more, diseases are not controlled. But if the LHW, they are trained and they are working, diseases are controlled. So LHW program is one of the success story in Pakistan, because epidemiologically it is effective. Then making community diagnosis, that is the fifth. Take in account socio-demographic data, because every community is different in its location, education, cultural practices, and religious practices. Then quantifying and summarizing in short form, in maps, in charts. You can give, even in pictograms, you can give a brief kind of which one is better, which one is not. Suppose there are two pictures, one boy is healthy, smiling, which has a full immunization, another child is limping, sick, and that has not received the immunization. Then that picture can transmit the message to the community. So this is a difference between clinical medicine and which we have already covered, but here you can see that the epidemiology focuses on group and it focuses on individual. It is a physician uses lab tools, and here epidemiology uses data collection and other methods, also the laboratory data. Does not take other factors into account, but here we take many factors. And then disease does not help in policy formulation. Here, whatever your data is, that will impact the larger groups, the country, the provinces. Not a quantitative science, but it is a quantitative science, because it is individual data, or you can see qualitative data, and one person blood pressure will not give you anything clue. Next. So this is a community diagnosis. You can see that in 1830, John Snow identified the cholera, and as well as in 1854, cholera outbreak was controlled. So this was a community diagnosis, and we call it leather shoe epidemiology. By walking in the community, you can ultimately John Snow identified the source of dirty water and cholera. When it was closed, then the cholera came down in London. Next, please. Yes, another cholera example is there. Next. So you can see that we use normally many other things nowadays, in which we have antibiotics, we have other pest control measures, so we can compare which one is better, which one is effective, which one is applicable. Next, please. So planning and evaluation of health services is also one of the function of the, I have already mentioned that if API is not reaching and eradicating the polio, then we have to review the data of the impact of the facility, and information about the disease, health facilities, health worker is important. Next. So these are important uses, community diagnosis and policies. Next. Understanding the disease process means natural history of the disease, and to identify syndrome is also one of the, and search for causes and risk factors, as well as association of 2 or more symptoms that will lead to the identification of the syndrome. Next, please. Yes, use it in public health surveillance, making projection, assessing the program, assisting in formulating medical teaching curriculum. Because in curriculum, on the basis of your data, you can change. Suppose this is a book of public health, which normally I am using in my lectures for MPH and as well as MCPS, FCPS. This is written by Shah, Ilyas, Ansari and Irfan. This is a standard book of the Pakistan, and I will be using in my other videos this textbook published from Pakistan. This is 8th edition, so please try to listen and reinforce your learning by using the Shah, Ilyas, Ansari and Irfan's book published from Pakistan. And you can see that it is a very huge book, and how the community medicine is developed in India. Park book is very famous, but in Pakistan I like this book. So with this I think we are concluding, but if the last slide is just projected. Another aspect is in research, assessing the effectiveness of diagnostic procedure, not only the treatment procedure. Suppose in COVID we used the PCR, and this is another example that how clinical medicine can be guided by the epidemiology, and these pictures are showing that which one is better. You can see that here the negotiations are better, understanding is better, but here distance and understanding is not better. So in patient counseling, in patient care, you require epidemiological understanding. Next, please. Epidemiology is indispensable to clinical medicine. This is the last and take-home message. I hope Dr. Hussain Kolachi YouTube channel has given you insight, and as well as I have certain notes in which there are few things that you can have some other things in epidemiology, and if particularly rise and fall of the disease, therapeutic trials, as well as you can have cause and effect also, and comparison in 2 populations. So with this I think we end, and we have taken certain support from this Ilyas Ansari book and some of the digital sources. Thank you very much.